welcome to Ivy Knowledge Bank. This is a new opportunity for Ivy Tech Central Indiana to really learn about something new and different. Something that people that may have some curiosities about, and also things that maybe you want to impart on Ivy Tech as well too. So I figured that the first major Ivy Knowledge Bank opportunity that we can discuss is COVID-19. Like, let's get real about that. And who else to talk about it than a doctor? And we have an amazing doctor here. I'd like to welcome Dr. Terri Litty. She is totally amazing. So I'm going to kind of give her the floor to kind of introduce herself and expertise. And we're going to get real about COVID-19, you all. Hi, Dr. Litty.
Hi, thanks for having me. So my name is Terri Litty, and I am a board certified family medicine doc. I did my residency at St. Vincent's in Indianapolis. I currently work for Eskenazi Medical Group. Um, I've been working with Eskenazi Medical Group for about 19 or 20 years. I did take a 3.5 year hiatus to do HIV and TB care in Swaziland, Africa. When I got back in 2012, I returned to Eskenazi because I love their mission, and have been working there ever since.
I think sometimes we depersonalize doctors. We just kind of think that they're just in their offices and then they go home and they come back to their office. So the fact that you have things beyond medicine that you've really been able to do advocacy and almost activism work within your work, I think that's cool. So congratulations for that. That's amazing, and also a testament for a lot of our students that may want to be medical doctors as well.
Yes, there are many opportunities to follow your passion and do whatever you want to do. The opportunities are out there if you look for them.
So this whole COVID-19, why I'm kind of shut in my house and, my child getting on my nerves a bit, talking to myself. Don't tell
Yes.
anybody. Shh.
As long as you don't answer, it's okay.
But this whole COVID-19, what is COVID-19? And can we talk a little bit about how it impacts our population and particularly Indiana? What is COVID-19?
So, COVID-19 is basically a designation that they have given it. The CO in COVID stands for coronavirus. The VI or the CO is corona. The VI is um, virus, and the D is disease. And that basically um, is the manifestation of the symptoms of the virus. The 19 is basically tells us when the virus was discovered. So we have a lot of coronaviruses. We've known about other coronaviruses, but this is a new strain of the coronavirus family. And that's why in the beginning they called it the novel coronavirus, meaning new. Um, the problem with it is that we don't know a lot about it. So we are learning as we're going through this pandemic how to deal with it. Um, and that unfortunately means that a lot of it is trial and error, and discovering how to manage the symptoms, manage the numbers of people infected, um, which is why we are all shut in our house because um, we realize that social distancing is probably one of the best ways to do that. Um, Regarding how it's impacting our communities, obviously, you started off saying that we are socially distancing, um, and many people are afraid to even go out of their homes. I speak to patients every day who are afraid to go to the ER when they're sick, and they're afraid to go to the grocery store, and they're afraid to take their kids to the doctor to get their well visits. It's sort of created this overall fear in the country and even in the world to do anything that we used to consider normal.
These COVID-19 has, got a lot of attention, and particularly when it comes to race. Um, I think it's a very uncomfortable topic for people to discuss, that certain situations and certain diseases and certain ailments impact particular populations a little bit more. So, can you talk just a little bit about maybe some of the racial disparities or even socioeconomic disparities that COVID-19 may have?
So again, I think there are some things that are causing, I think, different socioeconomically um, um, disadvantaged people to become uh, more sick or have worse outcomes than other people. And one of them is access to care. I think there's a lot of people who are uninsured and they don't have um, appropriate access to care, or like I said, they may be afraid to access the care that they do have available, just because of misinformation or just a general fear of getting the disease. A lot of people don't have access to transportation to get to places. They don't have access to copays, um, or they don't have money to pay copays for routine medicines, which may increase um, their comorbidities or the other diseases that they have that may be uncontrolled, like diabetes and hypertension, which we know increase the risk for having severe disease. Um, um, they may not have a real trust in the healthcare system. We know that there are many African American people who don't trust the healthcare system because of things of the past or things that they've experienced, perceived discrimination or actual discrimination. So there's a lot of reasons that we may not go when we should go, even even though we feel like we probably need to go, because they feel like they may not be treated well or they may not get the best care, etc. Um, so
Way more complicated than just, you know, individuals passing away or individuals contracting this. This can be very systemic in nature when it comes to, how people historically have been treated in the medical atmospheres, or even, other atmospheres where wellness comes involved. So, um, one of the things that really am excited about talking to you is, you're such a you have a great personality. You are, before, you all aren't going to see this part, but before we started this, we were laughing and joking around. And sometimes doctors can have this kind of stuffy, kind of um, very professionalized, over professionalized demeanor. So it's really good, especially for individuals that may have a fear of going to the doctor, to say, there's stereotypes about all different populations, even doctors, and there's so many different types of personalities, period, within individuals and professions. So it's good to see your nice and bubbly face and for us to talk about and give a little bit of light in this moment of sometimes pain for people. This has caused a disruption in employment, a disruption in family structures, deaths within family structures. So, um, sometimes having a little bit of light really can give people a little bit more of a positive optimism when it comes to this situation. So I
yeah.
thank you for that. um, so we're going to debunk some myths. And I thought of this after really looking through Facebook, and everybody has their own input about what will cure COVID-19. I've seen YouTube videos about sea moss. I've seen Facebook posts about saying, well, if you steep some orange peels and put some cayenne pepper in it and inhale it, then you will be cured. I've seen people talk about this elderberry, um, and also self-made hand sanitizer. So let's debunk some of that. Is there truth and merit to these things, or should people really just kind of leave this stuff to the doctors?
So so I too have heard, I have read some of the myths and some of the things that people are out there doing, like, drinking alcohol or bleach or gargling with bleach and, steaming over garlic and all of those. I think the most important thing is that, you know, coronavirus is a virus, and there's really no cure. We can hope to prevent it, um, and ultimately when a vaccine is developed, hopefully that will help with some of it. But um, ultimately, it's doing the things that the CDC says to do: social distance and wash your hands and use, legitimate 60% alcohol hand sanitizers. A lot of the times when people are making their own hand sanitizers, it's either not strong enough, or it has a lot of things in there that can be dangerous for you. So we don't want you making your own hand sanitizers. Um,
Man.
right. Um, and some of the other things, the sea moss and the garlic and the orange peels, and none of that is going to really cure coronavirus. It's not going to prevent you from getting coronavirus. It's not going to, cure you if you get coronavirus. There are some things, like you bring up elderberry. you know there are some natural products that will help boost the immune system. Elderberry is probably one of them. There's nothing wrong with taking some vitamin C, making sure your vitamin D level is up, um, those type of things. It's all about doing things to boost your immunity, but that includes things like, um, getting enough sleep. That's free. you know um, eating a good balanced diet. Eat the rainbow so that you're getting all the enough nutrients in what you're eating. I know that's for some of us who may be on a fixed budget. That may be a little bit harder, but whatever. There's a lot of food pantries and a lot of resources that have been poured into the COVID epidemic. So we really should be trying to promote, and get that information out as far as where people can go and get healthy food, et cetera, because that is one of the biggest things you can do for your immune system, is to eat healthy. And unfortunately, that's another reason I think that people, that there may be disparities, among low socioeconomic classes, because a lot of times we eat what we can afford, is not healthy, um, and that eating unhealthy, a lot of processed foods, foods high in additives, etc., will will decrease our ability to fight viruses. So we're starting off with a little bit lower immunity, and then when we get it, we aren't able to maybe mount as good of a response.
I'm going to address a very controversial Facebook post that I saw of
Okay.
a gentleman at a store who was eating some hot Cheetos
Oh,
with gloves.
the hot Cheetos
And
gloves store, yes.
yes.
Um, so first of all, I have a lot of friends. My son loves hot Cheetos. Um, I'm not anti hot Cheetos, generally speaking. Um, but if you're gonna wear the gloves to protect yourself, you probably shouldn't be eating the hot Cheetos with the gloves on. So, and that goes for wearing gloves to protect yourself anywhere. When you get home, before you put anything in your mouth, before you touch your face, um, you know, take the gloves off, because if there's coronavirus on your gloves, then you're going to infect yourself, just like you would if you didn't have the gloves on.
So, no eating hot Cheetos with your contaminated gloves.
Absolutely.
Please. All right. So there are some hospitals and centers around that are doing some testing for COVID-19. Some of them are free. Some of them have a charge. Um, we just want to make sure that you all are mindful as well out there that there's also some fraudulent people that are taking advantage of the system. I would always check with your hospitals and your health departments before you just roll up on some drive through that you may not know. Recently, the CDC seized a bunch of fake COVID 19 testing equipment. And we want to make sure that you all know the resources out there. So, is Eskenazi doing any type of testing?
So Eskenazi does have testing for established patients. Um, we have a testing site uh, that has been open, and we actually have another testing site on West 38th Street um, that is now reopened. So if you have symptoms of COVID-19 and want to be tested, reach out to your primary care doctor. You have to meet criteria at Eskenazi, so we're not testing everybody that wants to be tested, but we're testing a specific group of people. Um, but with that being said, your primary care doctor can direct you and get you the order and send you down to be tested if they feel that it's appropriate.
Thank you. Also, I found out that Indiana State Fairground started some testing April 29th that's free as well. And there's some other health departments that are doing free testing too. But also, it's always good and safe to go to your primary care doctor because you don't know if there's any underlying issues that may be associated with your symptoms, correct, doctor?
Yes. So I will tell you that it's allergy season, and I think that many people are having allergies, myself included. Um, and allergies can present like COVID. COVID is a virus, so it presents with a lot of cold symptoms. Unfortunately, it also presents with other symptoms that you may not associate with a cold, like nausea, vomiting. You know, um, some people have pass out or they get dizzy, diarrhea. There's a lot of other symptoms that can be COVID that we're just learning about. So if you do have a question about whether your symptoms can be associated, could be COVID or associated with COVID, reach out to your primary care doctor and they can recommend the appropriate course of action, whether that is self-quarantining or getting tested, etc. But I would just say, don't panic. If you think you have these symptoms, don't panic because it could just be allergies because, the weather's changing and it's beautiful outside and maybe you're just sensitive. Um, so there are many other things that it could be. And I think that we all assume uh, that it's COVID, but more than likely it's not. Um, but just make sure that you touch base with a healthcare provider or your healthcare provider to get appropriate guidance on what to do.
Well, thank you, Dr. Terri Litty, for talking with us today. Thank you, Eskenazi Health, for offering the space as well for us to have this conversation, and Ivy Tech Community College, in particularly Central Indiana service area, for having this space as well. So this is Ivy Knowledge Bank. Stay tuned. Second Fridays of every month, we're going to have Ivy Knowledge Banks, and this is going to be open to the public via YouTube. So feel free to subscribe and like this. And if you have any questions or would like to contribute to an Ivy Knowledge Bank as well, make sure you shoot us an email. All right. Bye, you all.